Hi, welcome to the Face of Bold Courage in August. Can you tell us a little bit about who you are and what you're doing in your school?
Hi, so thank you so much for having me. So my name is Taya, and I'm a PhD candidate at the University of Toronto. I'm entering my fourth year. I'm studying a couple different things in school, so one of which are invisible disabilities. So those are conditions that are a bit tricky to kind of see. They're less obvious when you're either seeing or talking to a person. And these also encompass or refer to those conditions that are a bit hard to diagnose or detect on blood tests, x-rays, and MRIs. And I'm really focusing on those conditions. And it causes a lot of uncertainty for doctors, which is another area of focus.
Taya, do you think you could tell us a little bit more about what you're doing in school and what your goal with your research is?
Yes, so the goal of my research ultimately is to create this framework or this medical school curriculum that can be, hopefully integrated into medical curricula across the globe so that we can better educate our future doctors on how to better treat invisible health conditions and cope and tolerate medical uncertainty.
What are two or three things that you think that are most challenging about having an invisible rare disease from a research perspective and a personal perspective?
Hmm. Well, there are many things I would say that are difficult having these types of conditions. So, in the research perspective, definitely we see that the entire diagnostic process and the diagnostic trajectory is very difficult and anxiety provoking for patients and also for doctors when there's a lot of uncertainty. Patients do complain about long diagnostic delays. So this means that they are not getting timely treatment. So they're suffering for long periods of time and they're not getting optimal care. So I think from a social perspective, the social experience of having these types of conditions is, again, very hard. For patients, there's a lot of suffering. I do think, especially if we look in the literature, there is a lot of skepticism, stigma, accusations of malingering or that you are faking what you have if you, quote, if you appear, quote, able-bodied or you do not look like you have a health condition. So I think that is very hard for patients and it amplifies the suffering that they are already experiencing.
Yeah, because my minor disorder took 4 years, and today, well, Thomas and Co is trying to get rid of those stereotypes,
Yes.
and still, the other day when we went to the stag market, I had a funny incursion where I actually ran into somebody, but yeah, they blame themselves because I'm on the wheelchair, but it was really all my fault. And that was hilarious.
Can you tell us a little bit about your experience studying what you do from both a patient and scientist perspective? Because I know you have a really unique role doing what you do.
Yeah, so it's something that we call in qualitative research, we call it insider status. So when you're not only an aspiring scientist or expert in your field, but you also have this unique lens through which you can see the work. So yes, I do have some experience on the other side being a patient. And I do think that offers, again, that unique perspective. It really shapes some of my questions that I ask with my research, and it motivates some of the things that I want to learn more about.
I can definitely relate to that, being a patient advocate rather than a patient in a field where I am a patient advocate for. And it provides a really unique insight that you can see amongst your peers that a lot of them don't necessarily have. And I think it makes us hopefully better scientists. So what does empathy mean to you?
Empathy. So I would conceptualize empathy as two things. So first, I think empathy is a skill. So I really think we can learn how to be empathetic, and I think we can train for it. There is research to support this, which is great. I also think empathy is a shared experience. It's not something that you experience on your own. It's between two people. So you, the person that's feeling the empathy, and the other person that you're feeling empathy for.
Why do people struggle to be empathetic? Why is empathy overwhelming?
Yes, I do think some people struggle to be empathetic. I think we as a society as a whole, we underperform our empathetic abilities. Mainly because I think when you are coming from your own positionality, right? Because empathy is about exiting your shoes, removing all those biases and judgments to enter momentarily into someone else's. I think that's foreign. It's so uncertain. It's a bit scary to feel what somebody else may be feeling when it is different from your own life experience. Now, in the context of sickness and illness, and something I guess that I've learned, I think as we're part of the younger generation, I think empathy is also, in order to be empathetic, we must confront the fragility of life. I think that is associated more with middle-aged to older age populations, and for us younger people, that again is a bit scary, overwhelming, anxiety provoking, emotional, also draining. I want to highlight that word.
A really, really good way to put it. How do you think then, to our viewers, from your experience and with your research background, how do you think we can be more empathetic to others? And is there a way to do so without necessarily getting overwhelmed that I think a lot of people fear?
Well, from the research perspective, when I study like empathy with medical professionals and doctors, I think when we are not empathetic, that it's a coping strategy, right? We bracket ourselves, we distance ourselves a bit from our patients to not be, quote, like contaminated by their emotions, right? To protect our own sanity. So I think the first thing that we can do, I really want to highlight Thomas's initiative here, what we're doing, cultivating the space on social media to talk about things that are not routinely spoken about, and to allow viewers to, again, for a moment in time when they're scrolling on their algorithms, to kind of identify with people that are everyday people who are having these experiences that may be different from their own. I think that's a good start. The second thing I would say is just by modeling empathy. So those that are comfortable being empathetic, if we can witness that and see that it really is this act of love, it's fulfilling, it's rewarding, I think that's a very strong catalyst for change, eradicating stigma, and more understanding for those with invisible conditions and rare conditions also.
It almost feels like a snowball effect, where the more you see it, the more you're more comfortable to do it, and then
the more
you can project. Yeah, you can project that elsewhere.
Yes.
So, thank you for coming here. I know in sharing your expertise, I know I learned a lot, and so thank you again for coming here.
Like Thomas said, thank you again for coming.
Well,
we
thank you for
learned
having
so
me.
much just about what you do, and you are putting forth wonderful things into the world. So please keep doing what you're doing.
Thank you.